This will look familiar, I realize, but we are getting into new material, I promise. I promise, I promise, I promise. Miss Estes.
Yes.
Miss Estes, I know that you expressed to me you were nearly in tears that you missed a portion of this yesterday. I remember holding you like a baby. You were a mess. And so I just don't want you to feel left out. So I want to make sure that we catch you up really quickly.
Okay.
So I'm going to just ask you to name the next 35 muscles really fast. So there is no pressure, by the way. There are 21 people watching you, however.
That's great.
So this is your anxiety moment. What is this muscle? Thank you all for being such a good sport. Hey, what is this muscle you're looking at, ma'am?
That is the rectus femoris.
Good. Okay. Well, hey, 1 down, 34 to go. All right. What's this?
The vastus intermedius.
Yes. What's this?
That's the vastus lateralis.
Yes. What's this?
Vastus intermediate. I mean, vastus medialis.
Yes. Sorry, I have to do that one too. What group? What is that?
The hamstrings.
Thank you. Ooh, what's this?
That is the brevis, the adductor brevis.
Adductor brevis, yeah. What's this?
The adductor longus.
Yes. What's this?
That is the adductor magnus.
Yes. What's this?
The gracilis.
Yes. What's this?
The vectaneus.
Yes. Okay. What's this?
That is the tensor fasciolate.
Yep, which inserts into the iliotibial band. Good. What is that?
That's the sciatic nerve.
Yeah. What's that?
That's the iliacus.
Yes, we learned how to stretch it today, didn't we?
We did.
Yes.
It really worked, too.
It really works, too. Except we left you lopsided. But anyway, what's this?
That's the psoas major.
Yes. Because not everybody has a minor. Yes. What's this?
That's the iliocostalis.
Yes. What's this?
Longissimus.
Yes. What's this?
And the spinalis.
Spinalis. Good. What are these?
The multifidi and the rotatories.
Yes.
On the bottom. Yes.
What's this?
It's the splenius capitis.
Yes, goes from the spine to the head. Splenius capitis.
Splenius.
What is this?
Oh, no, that one I don't know. That one is the... So that's a stumper.
That's okay. Miss Allure, what is this muscle? This is her expertise. That's what I'm calling her.
Okay.
Miss Allure?
The semi-spinalis capitis.
Yes, it goes for part of the spine to the head. Semispinalis capitis.
Okay.
Cool.
Semispinalis capitis. Okay.
What's this one?
And that one is the V one.
Mm-hmm.
Yeah, that one is the... I need to phone a friend on that one too.
Really? Because the friend that answered it last time was you.
Was it?
Like 30 seconds ago. This is just a different angle.
Oh, is it the splenius capitis?
Is it going from the spine to the head?
Well, yeah.
Oh, there you go.
That was the same picture?
Yeah. This is, by the way, the first level of training, everybody. Then we mix up the pictures, and then we start to discuss like how you would detect this if you didn't have the same pictures, right? Because like where does stuff really go? But we're getting there. You guys are doing good. What are these?
Yeah, those are the occipital.
They're under the occipital region, so they're called the underoccipitals.
Under occipitals. Okay.
But we would never say under occipitals. We'd use a word that means under.
Oh yeah, inferior.
That kind of means under. But this would be like more like a train runs under the ground, and we call it a.
Oh yeah.
Or a
suboccipital.
Suboccipitals. Good. What's this?
The trapezius.
Yes. Don't worry about that. What's this?
That is the quadratus lumborum.
You were right. What's this? Oh, what's this?
That is the obliques. right? The internal obliques. Oh, I don't know.
You missed oblique lesson. It was really good. If you take your hands and you put them on the outside of your...
Oh
this?
yeah.
Right,
And
this...
external.
Yep, and this would be internal. So these are external obliques.
External oblique. Okay.
What are these?
And the internal oblique.
Yeah. What's this?
Rectus abdominis.
Yep. What's this?
That is the side muscle.
It is the sidus musculus.
That is. Is it the
Yes,
I
it
don't
is.
even know.
You just have to say it though.
Is it an ab muscle?
It is an ab muscle.
Ab-
Yeah.
The transverse?
Do the
Is
fibers
it?
do the fibers go across like in a transverse plane?
Sure.
Yeah.
Yeah.
Sure.
Okay.
All right. What's this?
That is the sternocleidomastoid. Yeah, it's one of those
Clydal.
sternocleidomastoid.
Sternocleidomastoid.
That's clidal.
Yeah.
Sternocleidomastoid.
Good.
Okay.
What's this?
The deltoid.
Good. What's that? It's half of.
Trapezius.
Half trapezius. Good.
Half of
What's this? In red. There's a lot there.
lats.
That is.
The latissimus dorsi.
Thank you. What's this?
That is the I know it. It is the major, teres major.
Yes. Anytime I say latissimus dorsi, you say teres major. You're all cut up, ma'am. Just want to make sure you're filled in
Hey.
there. Miss McDowell, Miss Mejia.
Hi.
Hi. Okay. Oh, you're being driven while you learn.
Yeah.
You have a driver.
Heard by my man.
Yeah. I love it. Cool.
Oh yeah. Okay.
All right. Can you see this picture, I hope?
Yes, I can.
What is this muscle?
Is it the teres major? Yeah.
It is the teres major. Teres major is lower on the scapula. It attaches to the inferior angle and all that good stuff. So that's teres major. Good. What are these two muscles?
Are those also the teres muscles?
I don't know. You tell me. You're answering my question with a question. That's unacceptable.
The teres is.
The teres is teres junior and senior, teres lateral and medial, teres
Minor?
What?
Teres major, teres minor.
Cool. Which one is more superior?
Teres minor.
Yep, minor rides on the shoulders of the major. You are right. Very good. Which is that? What's this?
Infraspinatus.
Infraspinatus. What is that in red?
Teres minor.
It is. And everybody, this is a very important picture. If that muscle was not in red, the infraspinatus and the teres minor would look like the same muscle. That's why we refer to them together. I say teres minor, you say infraspinatus. I say infraspinatus, you say teres minor. They feel like the same darn muscle. They're going to the same place. It really does feel the same when you're massaging them. So they go together. Yeah, you're getting kind of globbly there. Getting very strange background noise. But anyway, this one's tricky because the angle. What do you suppose this muscle is?
I'm gonna assume that that's the subscapularis because we were talking about scapular muscles.
Yeah, we're talking about rotator cuff muscles. It is the subscapularis. That is actually the way you access the subscapularis because it's actually on the anterior side of the scapula. We think of it as underneath the scapula. From the back it is, but it's on the front of the scapula, the anterior side of the scapula. That is the subscapularis. Is there a reason you sound like you're in a fishbowl with some guppies?
Oh yeah, I'm so sorry.
No, it's okay.
Life-proof phone case because I broke like 2 phones in 2 months, so
I feel like this is a very Miss Mejia kind of, yeah. She's like,
Yeah.
so I have to, so it's your phone is wrapped in bubble wrap and all that kind of stuff, yeah.
Yeah, so I'm very sorry.
It's okay. I just
The
thought.
case covers the microphone, so my audio quality sounds horrible. And
Well, when you're talking, it sounds fine, but we get this like you're in a fishbowl, I think. Anyway, no
I
problem.
could see. I don't know, but
Don't
yeah.
worry about it. What's this muscle?
The supraspinatus.
Yes. What's this muscle?
Teres minor.
Yes. I don't even know if this is a fair question because I'm not quite sure. I'm assuming they're talking about a muscle group here.
The rector spinae group.
Yeah, that's what I think they're trying to say, yeah. What's this?
Rhomboids major, rhomboids minor.
Yes. You already know that one. What's this?
I'm gonna say levator scapula.
You sure?
Yes.
You're right. Levator scapula. We already know what that is. What's this?
Serratus anterior.
Yes. What's this?
Pec major.
Yes. What's that? Oh, well, that doesn't help you. It tells you. Pec minor. What's this?
Bicep brachii.
What's this?
Brachialis.
Yes. What's this?
Triceps brachii.
Yes. What's this? This one's tough.
Coracobrachialis.
Apparently not for you, though. They're trying to make a point here. What's the muscle in red here? It's on the anterior side of the arm. It's under another muscle. That's what they're trying to point out.
I don't know what they're trying to show me.
The muscle in red. The muscle in red.
Are we talking about, is it the biceps brachii again?
Biceps brachii is more superficial. What's underneath it?
Is it the brachialis?
Yes.
Oh,
They're
okay.
just trying to kind of point out to you when you're looking at the side of an arm, this is the bicep, but actually the brachialis is right underneath it, on the front side of the arm. Good job. That's it. Hey, Miss Mejia,
Yes.
you might have some stuff to learn about massage, but you are excellent at anatomy. Take that in. I don't think, and I'm not trying to compare people, but I think a lot of people would have had an extremely hard time doing what you just did. Seeing those pictures for the first time, you are kicking ass, and you have your own superpowers, okay?
Everybody's got a superpower. I can just look at things and,
Yeah.
know what
By the way, which is a to be able to visualize muscles is one of the most important things a massage therapist can do, and you've got that. Cool?
I appreciate that.
Good, because it's your superpower. Yeah. Thank you, ma'am.
Thank you.
Okay. So, let's go back. Bum, bum, bum. Bum. Bum, 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 bum. Sorry. Okay, that's a good place. Okay. Mr. Blygen. Mr. Blygen, going once. You there?
No, I'm here. My phone got lost in the sheets.
Mr. Blygen, that's a little too much TMI even for me. No, I'm kidding. Sir, what muscle is this in red?
That would be that's not the serrated. That's the latissimus dorsi.
Yes, the lateral back muscle, latissimus dorsi. Beautiful. What's this muscle?
Teres major.
Yes. What's these two muscles?
The teres major and minor.
Which one's on top?
The minor.
Thank you. What muscle is this?
The infraspinatus.
Cool. What muscle is this in red? It's probably both, but anyway, what muscle's in red?
The teres. That's gonna be the. It's a little bit higher up. Let's go with teres major. Oh no. Yeah. Yeah, let's go with that.
I'm not going with that.
Then minor.
Yeah. Notice how the minor looks like it could be part of the infraspinatus.
Mm-hmm.
If they didn't change the colors on us, you guys wouldn't be able to tell. I wouldn't be able to tell the difference. They would actually look like just some strands going all the same place. Anytime I say infraspinatus, you say teres minor. Cool. What muscle is this, sir?
Serratus anterior.
Serratus anterior is these little guys poking out down here that look like sawtooth. What's this stuff right here? It's on the anterior side of the scapula.
Oh, the subscapularis.
Yes. What's this?
Supraspinatus.
Yes. What's this?
Teres minor.
Yes. Don't worry about that. What's this?
That's weird to look at.
It is weird to look. It's going from the medial border of the scapula to the spine of your spine.
Oh, rhomboids, major and minor.
Yes, rhomboids major and minor. That's a better picture probably. What's that?
That's gonna be the levator scapula.
Cool. And what's that?
Hold on. Serratus anterior.
Yes, it looks saw-like. It's got teeth. Serratus anterior. Goes from the medial border of the scapula to the first 8 or 9 ribs. Beautiful. What's this muscle, sir?
That's gonna be pec major.
Yes, it is. What's the muscle found underneath the pec major?
Pec minor.
Yes, good job. What's this muscle, sir?
Biceps brachii.
Thank you. What's this?
Brachialis.
Yes, sir. What's this?
Triceps brachii.
Yes, sir. What's this?
Coracobrachialis.
Woo! That one usually stumps people. What's this muscle in red?
That's gonna be the. Hold on. That's not part of it. That's the.
It is on the anterior. Yeah, go ahead, say it.
That's the
Say it.
brachialis.
Yes. It's on the anterior humerus underneath, deep to the biceps brachii. Good job. Okay. Thank you, sir. Thank you, thank you, thank you. Okay. Now we're going to jump around a little bit here. Mr. Brown.
Hey, Mr. T.
Hey, buddy. Wow.
My mom says she actually wants to give it a shot.
Your mom?
Ain't that right?
What? I
Well, one of you needs to tell me what this muscle is.
do. Oh, I pulled that muscle. That is the
It's not a good thing.
trap something. Trapeze.
That's trapezius.
The trapeze is back
This
here.
is something different.
Oh, I don't know if that one is then.
Shit, what is that? I was acting all big. I don't even know it. It's not the latissimus, is it?
I don't know. You tell me, sir.
See, I always see the one thing. Sometimes I be guessing right, and then you like, then I be second guessing myself.
Well, with all due respect to it, would help if you watched what other people guessed.
Yeah.
Because
That would.
we got over it a couple times.
Yep, somebody else did say it.
So it is latissimus dorsi, sir. I'm going to come back to you. Watch the next person. Miss Hawks.
Hi.
Hi, Miss Hawks. Miss Hawks, what muscle is this?
That's the latissimus dorsi.
Thank you, Miss Hawks. What's this?
That is the the teres minor. No. That is the
If I tell you latissimus dorsi, you say,
teres major.
yeah, thank you, ma'am. You were close. All right. What are these two muscles?
That is the infraspinatus and then the teres minor.
I get what you're saying, and actually, I love this. You're wrong, but I love why you're wrong because you use the right logic. The infraspinatus would be right underneath the spine here. So these are even lower down, but your logic was right. So half your answer is right. It's hard.
My bad.
I'm going to mute you, Mr. Belagian, because I don't know what you're doing there in the sheets with your phone and stuff. Yeah. So what could it be, ma'am?
Would it be the teres major and teres minor?
Yes, ma'am. Absolutely. Good job. teres major and minor. Good job. What's this now?
Yeah, that's the infraspinatus.
Yeah. So do you see kind of like there they are and the infraspinatus is above them?
Yeah.
Woo, cool. Good job. What are these two muscles then?
The teres minor and then the infraspinatus.
Yes. Which one is in red?
The teres minor.
Yeah. You're good. This is good. Thank you. What muscle is this?
That's the subscapularis.
Cool. Cool, cool, cool. What muscle is this?
That's the infraspinatus.
Close.
The
This is inferior down here.
the supraspinatus. Oh my god.
Yeah. It's hard, actually. So what's this?
That one's the teres minor.
Cool. Awesome. Awesome. Don't worry about that. What's this?
Those are the rhomboids.
It sure is, ma'am. Thank you. What's this?
It's the levator scapula.
I love it. What muscle is this in red?
The serratus anterior.
Cool. Good job. What muscle is this?
That's the pec major.
Yeah. What's underneath the pec major? Deep to it.
Pec minor.
Yes. Pec minor. 3 strands, everybody, attaching to ribs 3, 4, and 5, coming from the coracoid process, which is part of your scapula. This is why really good massage therapists massage the chest when there's shoulder tension. Because they pull front and back. There's actually an argument between front and back. Cool. What's this, ma'am?
That's the biceps brachii.
Cool. I love it. Biceps brachii. What's this?
That is the brachialis.
Yes. What's this?
That is the triceps brachii.
Yes! By the way, everybody, you can't see all 3 heads of the triceps brachii because one is underneath the other 2 heads. Just so you know. There are 3 heads there, but one is underneath the other 2 heads and you can't see it. What's this, ma'am?
That's the coracobrachialis.
Ma'am, you're doing extremely well. What's this muscle? It's on the anterior humerus, but it's a little bit deep to another muscle.
That's the brachialis again.
You are right, again. That's it. Thank you. It's been a pleasure. Okay. You guys memorizing this? No. All right. Miss Zhong. You know I'm going to go back over these because that's what I do.
Hi.
Hi. What muscle is this?
Yeah. rectus femoris.
Yeah. What muscle's this?
Rectus vastus lateralis.
It's not lateral though. It's more in the middle.
Inter.
Yes, vastus intermedius.
Intermedius.
Good. Okay. What's this?
Vastus medialis. No.
No.
Lateral.
Yes, lateral's on the outside,
lateral.
medial's on the inside. Yeah. Vastus lateralis. Good. What muscle is this one down here?
Vastus medialis.
Okay.
Medialis.
So let's make sure we got all these really quick. What's that?
Rectus femoris.
Good.
Yeah.
What's this?
Vastus intermedialis.
Intermedius. Yeah, that was beautiful.
Yes.
That was beautiful. Vastus intermedius. It was good.
Yes.
What muscle is this?
Vastus lateral this.
Vastus lateralis. That was beautiful. My God. Okay. What muscle is this?
Vastus medialis.
Good. We're gonna take on a couple more. So just hold on. What muscle group is this? It's on the back of the leg.
Hammer.
Yeah. Hamstrings.
Hammer straight.
Yeah. Just say ham
Ham
strings.
straight.
Yeah. Hamstrings.
Ham straight.
Hamstrings. Yeah.
Ham straight.
Okay. Hold on. We got a couple more. We're building up your vocabulary, and you're doing great. This is really the vulnerable class, everybody. Whether you're facing your clients or you're facing your language or whatever, this is very impressive, all of you. Okay. This is, do you know what this is? It's okay if you don't. It's okay if you don't.
This.
It's okay. So, Miss Young. Miss
Yeah.
Young. Abductor.
Yeah. Abductor brevis.
Yeah, abductor brevis. Or brevis, that's great. Abductor brevis. What's this one?
Brevis. Abductor.
Long.
Abductor longus.
Yeah, adductor longus, yes. What's
Longus one.
and what's this one?
Abductor
Yes,
Magnus.
Magnus. Adductor magnus. That's good. Two more.
Magnus.
What's this?
Yeah. Abductor longus.
No, you already did longus. This was back here. That was longus. This one is gra.
Yeah,
this one's hard.
This.
Gracilis.
Grassless.
Yeah, pretty good. Gracilis.
Grassless.
That was good. Gracilis, thank you.
Grassless.
Yeah, that was good. And last one. What's this? That's beautiful. Pectineus.
Pectineus.
Beautiful. Let's do them one last time. What is this? Adductor what?
Abductor brevis.
Adductor brevis. What's this?
Abductor.
Oh.
这不是想不起来了。
It's hard.
Abductor.
Longus. Longus.
Longus.
Yeah, adductor longus.
Longus.
Yes.
Abductor longus.
And what's this one?
Abductor magnus.
Yeah, adductor magnus. Good. What's this? Yeah. Gra.
Gray.
It's hard. Gracilis.
Gracilis.
Beautiful. This is very hard. You're doing very good. What's this? This one's hard too.
Pectinus.
Yeah, Pectinius. Good. Okay, so sorry, but of course we have to put them all together. We have to one time.
Yeah.
All right, what is this? Yes, rectus what?
Rectus femoris.
Rectus femoris. Yeah. What's this?
Vactus intermedius.
Yeah. Vastus intermedius. Bam. What's this?
Vactus lateralis.
Vastus lateralis. Bam. What's this?
Vactus medialis.
Yes.
Medialis.
What muscle group is this?
Hammer.
Yeah, hamstrings.
Hamstrings.
Beautiful.
Hamstrings.
What muscle is this?
This
It's an adductor.
brevis.
I like how you said that. Adductor brevis. That was a really good way to say it.
Adductor.
Adductor brevis. What's this?
Adductor longus.
Yeah, that's it. Adductor longus. Good. Just 3 more. You're almost there. What's this?
Adductor magnus.
Yeah, adductor magnus. Bam.
Magnus.
What's this?
Adductor magnus. Adductor gracilis.
Yeah, gracilis. Yeah, good. Last one, I promise. What is this?
Pectinus.
Very good. If I had to stand in front of a group and do what you just did, I think I would quit. So I really would.
Thank
So
you.
Thank you. Beautiful. Thank you. All right. Miss Walker, why?
Hello.
Hello, ma'am. Don't let Miss Zong show you up, okay?
You might.
She just kind of knocked it out of the park there. So let's see where you're at, madam. Let's pop up here a little bit. Well, actually, these are all fun stuff. What's that, Miss Walker? Why?
Ilio something.
Iliacus.
Iliacus.
Cool.
Yeah.
Good job. What is this?
Is that psoas main? I don't know what the last part of it is called. Psoas something. Major? Psoas
Yeah.
major?
Major. It's majorly important. So as major.
Okay.
Good.
Sometimes I think I'm making up words.
It does feel that way, yeah. It really does. Sometimes you're like, how many like Harry Potter endings should I put on this thing? Yeah. What's this?
Iliocostalis.
Beautiful. Iliocostalis. Nicely done. What's this?
Is it longissimus?
I sure hope so. Good. What's this?
Spinalis.
Yes, ma'am. What are these?
Rotaries. And
Rotatories.
rotatories and multifides.
Yeah, which one's on top? On the left-hand side.
Multifides.
Very good. Nicely done. What's this?
This is a long one. I'm pretty sure. Can you give me a hint?
It goes from your spine to your head, or your spine to your cap.
I don't remember the name of that one.
Well, what if we just call it like spinal spinius capitis, or maybe splenius.
Splenius capitis.
Splenius
Okay.
capitis. Cool.
Yes.
What's this one, ma'am?
Semi-spinalis capitis.
Yeah, it goes part of the spine to the head, semispinalis capitis. Beautifully done. What's this one?
Splenius capitis.
Good. Good, good, good. What are these? What group is this?
Suboccipitals.
I love it. Yes, ma'am. What's this?
Trapezius.
Yes. Forget about that. I hate that. What's that?
Quadratus lumborum.
Yep. So what's that?
External obliques.
Yes, actually, you were right. External obliques. And what's this?
Internal obliques.
Yes. What's this?
Rectus. No. Pectoralis something. I don't know.
Pectoralis.
Abdominal something.
Good, thank you. So you admit it's an abdominal. It's an abdominal with fibers running straight up and down.
Oh, rectus abdominis. Or
Oh,
abdominal.
that's a good name for that. Yeah, rectus means up and down. Erect, up and down. Rectus abdominis, you are correct, ma'am. Good job. What's this? Besides a hand, for some reason, coming into a picture.
That's part of the abdominals. Transverse.
Yes, you're right. It is transverse abdominals. The fiber's actually running across.
Okay.
What's this?
That's the long one.
The long one.
Long name.
Oh, the long name. It is the long name. Yes. It's named by its 3 attachments.
Mm-hmm. Can you say those 3 attachments? Or one of them?
Sternal.
Sternocleidomastoid.
Good.
Mastoid.
Yeah, sternocleidomastoid. Bam, bam, bam. Nicely done. That was funny. What's this?
Deltoid.
Sure it's not the pecs?
Absolutely.
Good. All right, just want to make sure, because I got a little scared there with the abdominal one. I'm teasing. You already know what that is. What's that big red muscle there?
Latissimus dorsi or dorsi.
Latissimus dorsi. We'll take either one. Beautiful, beautiful. What's that? Anytime I say latissimus dorsi, you say
teres major.
teres major. You redeem yourself there. That's pretty good. Okay. So what are these 2 muscles?
Teres minor and major, or major and minor.
Major and minor, or minor and major?
Yes.
Okay. Which one's more superior?
The minor.
Yes. Good job. What's this?
Infraspinatus?
Yes. What are these 2 muscles?
Are those, is that teres minor? Major? No.
Well, you're in the right area. You're in the right track. It's 2 muscles that I always like to say together. Kind of like when I say latissimus dorsi, you say teres major. When I say this other thing, you say this other thing. And they're both rotator cuff muscles. So they're, do you know your 4 rotator cuff muscles? The names? I didn't mean that so snottily, by the way. I just meant, can you say the 4?
Infraspinatus, teres minor, and subscapular. That's the subscapularis.
Well,
No.
subscapularis actually means under the scapula, and this is on top of the scapula.
So is it the teres minor and something else, or is that not?
Yeah, no, it is. There's a teres minor there. So what does teres minor always go with?
Infraspinatus?
Yes, infraspinatus and teres minor go together. And if these weren't colored different colors, they would look like the same muscle. Yeah?
Yeah.
Okay. Good. Sometimes I feel like maybe you guys aren't all watching. Sometimes you're very cute, though. What is this?
Is that the subscapularis?
Yes, it is, ma'am. Good job. All right, let's let you off the hook. Take a break. That was good. Thank you, thank you. Thank you. Okay, Mr. Placencia. I know it's hard sometimes, huh? Okay, sir. Sir, let's run through some of these, all right?
Let's do it. Let's do it.
Let's do it. What's this?
That is the supraspinatus.
Good. What's its action?
Its action, it does this thing.
Yeah, he's exactly right, by the way, because if it's on top and it pulled, it would do this thing.
It does it abducts the shoulder.
Yes! All right, for an extra bonus point, which you're never going to get, I don't mean you're never going to get the question, I'm never going to give you the bonus point, but for $1 million, like, what is the name of the shoulder joint that it's abducting?
The glenohumeral joint.
Damn, glad I'm not going to give you that $1 million. That was going to cost me a lot of money. Beautifully done, sir. Okay, what is this muscle?
That is the teres minor.
You are correct, sir. So, what is the these are hard questions, by the way, but what is the action of that muscle?
It's attached to the scapula. It grabs onto the back of the humerus, so it will rotate your arm that way.
Yes.
Laterally. The lateral rotation.
Lateral rotation of the glenohumeral joint, which it actually is rotating your arm, but it's because of the glenohumeral joint.
And it will
Beautifully
also
done.
adduct your arms.
Yeah. I'm sure you're right. Just because of its position, you can see it pull back in, right? Nicely done. I like how I feel like you didn't memorize that. You literally figured it out.
Yeah.
Yeah, because that means you'll have that forever. So what he did, guys, is he kind of thought to himself, like, if I was pulling from behind me, it would roll my shoulders out. Very good. Really well done. What muscle group is this? It's a whole group.
Erector spinae.
Okay. What is the action of the erector spinae if they work bilaterally, which means both sides are pulling?
They will flex your spine.
Really?
Is that what I mean? Extend your spine?
Extend your spine. Behind you is extend. They'll pull you back like
do
this.
the dolphin.
Yeah. You'll do the dolphin. Yeah, they'll extend your spine.
Extend your spine.
What if they work unilaterally?
Unilaterally.
Just one side.
You will, you just bend to one side.
Yeah, you will bend to one side, which is exactly
lateral
what
flexion.
Thank you. That's exactly it. Lateral flexion. Thank you. Wow. You're doing
Thank
great,
you
sir.
for everybody who is waddling around.
Yeah, but the hard part was actually naming it then too. You know what I mean? What is
Rhomboids.
this? Rhomboids. Okay, sir. And I think they perform two actions.
They do.
Thank you. What two actions they perform, sir?
Primarily, they adduct the shoulder blades together.
Mm-hmm.
And then the other one, they can help elevate the scapula.
Yes. So he knows that they're back there so they can pull your scapula in closer, but because they're running diagonally, they can lift it up a little bit. They can elevate and they can adduct. For bonus points, tell me another word for adduct the scapula.
Retract.
God. All right. You're on fire, sir. Good. Hey, what muscle's this?
Trapezius.
Okay. Tell me the actions of the trapezius.
Okay. The upper fibers will elevate the scapula and also will rotate them.
Yeah, that's true. They'll give you some rotation too. Cool. Yeah.
Rotation. The middle fibers will adduct the scapula.
Yes, or retract. Or they'll kind of, yeah, go ahead. Sorry, sir.
And the lower fibers will depress the scapula.
Pull it back down. It's good stuff. Okay. What's this guy?
Levator scapula.
I'm not going to ask you the action because I feel like the name says it all. But tell us anyway, just in case anybody doesn't know.
They elevate the scapula.
Elevate the scapula, yes. And by the way, everybody, that's a tricky little sucker because it attaches, it's got 4 attachment spots inside the side of your neck on your transverse processes of C1, C2, C3, C4. And that's where a lot of important nerves come out, like your brachial plexus and stuff. So this can be a big headache, neck ache kind of muscle, even though it's a tiny muscle, right? Sometimes it's the tiniest muscles that are most irritating, to be honest with you. Sir, what's this?
Serratus anterior.
Sir, you are 100% correct. What are the two actions of the serratus anterior?
They will protract your scapula,
Yes, protract or abduct the scapula.
abduct the scapula, and they will also depress the scapula.
It was. They run down a little bit, so they will depress. They do the exact opposite of the rhomboids. Rhomboids kind of pull you back and up. Serratus anterior pulls you front and down. Yes, nicely said, sir.
Antagonistic.
Yeah, they're antagonistic. They can argue with each other. Beautifully said. So it's not unusual to rub these when somebody has tight shoulders so you stop the argument. Nicely done. What's this, sir?
Pec major.
Cool. And what's underneath it?
Pec minor.
Cool. Let's go do one last thing, sir. What is this?
Biceps brachii.
Yeah, you're exactly right. It is the biceps brachii. What's its main action first?
The main action is, as everybody knows, the curl, which is to flex the elbow.
Flex the elbow. He's exactly right. Flex the elbow in front of your body, right? Flexion of the elbow. Do you know what the elbow joint is called?
The elbow joint, I do not know what it's called.
Got it. It's where the ulna and the humerus meet. So it's the humeral ulnar joint.
Oh, okay.
Humeral ulnar joint. Very good. Cool. I said one last question, but let's do one last more. What's this?
That is the brachialis.
Yes. What are the two actions of the brachialis?
It only has one.
Yes! That was good. I'm sorry, sir. I was like, I got to win somewhere, and I lost every time. It only has one action, which is what, sir?
To flex the ulnar
Humeral ulnar joint.
Humeral ulnar joint.
Yeah, that's all it does all day long. It can't not do that. It always has to do that. It doesn't cross over any other joints. It doesn't really do anything exciting. And it's what you guys are really working when you're working curls. Don't get me wrong, you're working your biceps, but this guy that's all it knows how to do. It's like I bend an elbow. That's what I do. That's it. Where if we go back to here, this guy's main action is to flex the humeral ulnar joint. Does the biceps brachii have any other actions, sir?
Since it crosses the shoulder, it can also flex the shoulder.
It can also cause a flexion of the shoulder. It's not your major shoulder flexor. You better have the deltoids involved and all sorts in upper pecs even. But it can do that too. Not bad, sir. See me after class for some tutoring. We'll talk later. Okay, good stuff. I really like that. All right. Thanks for the actions. That was really, I love it when people don't memorize actions. They actually think them through, right? All right, Miss Carodi, are you there?
Yes, I'm
Yeah?
Hold
You
on.
sure?
We need to.
Okay. Miss Carodi, what muscle is this? It's adorable. It's not working at all, but it's adorable. Miss Carodi, we can't hear a word you're saying.
Oh,
Oh,
so
there we
now
go.
I got it. Sorry.
Okay, don't be sorry.
I got it.
Miss
No.
Carodi,
Yeah.
this is the funny stuff that happens in class. Don't
Iliac
worry.
muscle. Iliac muscle.
Iliacus muscle, yeah. Good job. What's this
Yeah.
muscle?
Serratus major like a long knife.
What'd you say? So it is psoas major, but I didn't hear that.
Pressure major like a knife. From the knife.
Oh, like a knife. Okay. Ooh. Guess. Okay. Anyway, what's this?
Iliocostalis.
Yeah, iliocostalis. Iliocostalis.
Yeah.
This one's
Yeah.
hard to say.
Yeah.
Iliocostalis. Beautiful.
Costalis.
What's this?
It's a longissimus.
Longissimus. Yeah. What's this?
Spinalis.
Spinalis. Beautiful. I love it. What are these two muscles?
That is.
She's got to consult.
Wait, sorry, I had.
Did you just swan at your husband?
No, I have 5 customers walking in. I see the camera. Sorry. Multifidian muscles.
Yeah. Multifidi and what?
Rototores.
Rototores. Yeah. Multifidi and rototores. Nicely said.
Yeah.
What's this muscle?
This spinous capitis.
Splenius
Spinous
capitis.
capitis.
Yeah. Beautiful. You're a very impressive young lady. Yeah. You're lucky. Your husband's very lucky to have you. I'll remind him of that.
I like having him.
You are actually. So what is this?
Like semis spinalis capitis.
Yep.
Capitis.
Part of the spine and the head. Semispinalis capitis. Beautifully done. What's this again?
Spinous capitis.
Beautiful. And what are these?
Suboccipital.
Yeah.
Occipital.
Suboccipitals.
Yeah.
Occipitals. Yeah. Say it one more time and you're done.
Okay. Suboccipital.
Sub?
Occipital.
Wait, hold on. What?
I don't know.
It's okay. It's okay. But say sub.
Suboccipital.
No. Just stop for 1 second. Just say sub first.
Sub.
Now wait. Ox.
Occipital.
Okay, suboccipitals. Cool.
Sub-
Thank you, ma'am. We're good.
Yeah.
We're
Thank
good.
you.
Thank you. Mr. Tate. Mr. Tate.
Hello, Mr. Thompson.
Hello, sir. Are you driving?
No.
Good. I didn't want you looking at pictures while you're driving, that's all. I'm about to ask you questions. All right, sir. What is this?
The trapezius.
You are right. Ooh, now forget that. What is this, sir?
The quadratum laborum. Quadratus laborum.
Yeah, quadratus laborum. Good job. What's this?
That is the external obliques.
Yeah. What's this?
The internal obliques.
Yeah. What's this?
The rectus abdominis.
Yes, hold on 1 second, sir. Yes, Miss Suriel.
I'm so sorry. It was a mistake.
Oh, that's okay. I just didn't want to ignore you, and I thought you were gonna be like, "Hey." Anyway, never mind.
No. I'm sorry.
Don't be sorry at all. Sir, what did you say this muscle was?
The rectus abdominis.
You're right, sir.
Abdominals.
Yep.
Abdominis.
I think either one is actually correct. You could probably say rectus abdominis or rectus abdominals. I don't think it is a language. People will understand a few changes. What's this?
The transverse abdominis.
Transverse abdominis. Yeah. What's this? It's the long one.
The sternocleidomastoid.
Beautifully said, too. The sternocleidomastoid. What's its nickname, sir?
Oh.
As a
Mr. Rydell knows. I don't. I'm sorry.
But I bet you do. As a spiritual man, this nickname would mean something to you. Its action is to do this, which is very nice when I'm doing this.
Is it the prayer?
Yeah, it's called the prayer muscle. Yeah,
the prayer muscle.
I mean, I don't think it was called that when I went to school. It may not be called that anymore. I went to school a long time ago. I don't know the last time I heard it, but anyway, it is called the prayer muscle. Yes, nicely said. What's this, sir?
The deltoid.
Yeah. What's that?
The trapezius.
Half a trapezius. Yes. What's this big muscle here?
It's the latissimus. It's the lat.
It's the lats. Latissimus dorsi. Cool. And last question. What's this? It goes with the latissimus dorsi.
The teres major.
Yes. Latissimus dorsi is huge, so it goes with teres major. Infraspinatus is little, so it goes with teres minor. Well done, sir. Thank you. Mr. Brown. Oh, and yes, Miss Mejia, please.
I actually just had a quick question about the sternocleidomastoid.
Please.
It kind of like the anterior neck. So is that kind of like the stopping grounds for like you don't want to go any more further in from that, or else you like risk getting the trachea, like when you're giving someone
Yeah.
So that's kind of like the stopping point. You hit that, and you're like, okay, don't go.
Yeah, let me, I essentially agree with what you're saying. I just want to see if I want to get back to it. Yeah, it is. So, by the way, with the understanding that it's not going to be the end of the world, you could do this all day long, but it's probably the last important muscle before you get to the suprahyoids and infrahyoids, which we don't massage that often. So, in a standard massage, yes. I definitely want to hit the SCM, the sternocleidomastoid, but I probably don't want to go more medial than that in a standard massage. There are times when we get crazy and go in there, but you're absolutely right. As a general rule of thumb, I would definitely, if I was teaching a massage class and I want to give people rules, I'd be like, don't go past this. You're absolutely right. But you're not going to kill somebody by touching them here, even rubbing them here.
Yeah.
You're more likely going to annoy them. Yeah. But yes, as a good rule of thumb, this is a good place. This is the triangle to stay away from. You're right. Well said.
Okay. All right. I was checking. Thank you.
No problem. Mr. Brown.
Yes.
All right, sir. What muscle is this?
Latissimus dorsi.
Yes, sir. Thank you, sir. What muscle is this?
That's the teres major.
Yeah, good job, sir. What muscles are these?
The infraspinatus and the teres minor.
Your logic is correct, but you're not quite right. This area right under here is where the infraspinatus would be. So what are these two muscles that are even lower than it?
Oh, that's the teres major and the teres minor?
Yes, which one's on top?
The major. No, the minor is on top.
Minor's on top, because it's going to go with the infraspinatus later. Yeah, good. What muscle is this, sir?
That's the infraspinatus.
Yeah, so look, there, teres major and minor, infraspinatus. I think that's kind of helpful. All right, what two muscles are these?
Is that the same ones, the infraspinatus and the teres minor?
That is, and they go together. They are the two rotator cuff muscles that go together because they have the same action. And they really look like the same muscle if somebody doesn't nicely color them for you in a slide. They feel like the same muscle. I guarantee when you guys are massaging people, you don't know when you're on the infraspinatus or the teres minor. And by the way, I don't either. I don't mean it like I'm so advanced. I know. It's very hard to tell. And we don't care. They're doing the same thing, going the same place. Nicely done. What's this, sir?
That is the... Damn, I just had that one. I was just talking about that one. That's the...
It's under the scapula, but you have to get to it from the front because it's under the scapula.
That's the subscapularis?
Yes, sir.
Oh.
Good job.
Oh.
What's this?
That's suprascapularis.
Supraspinatus.
No, supraspinatus.
But that was good, sir. That was really good. All right. What's this?
It's the teres minor.
Yeah. Don't worry about those. What's this, sir?
That's that's the rhomboids.
Yeah. Good job. You're done, sir. Thank you. That was really good. Thank you. Thank you. Thank you. Thank you. Miss Lobitz.
Okay.
Okay. Miss Lobitz, what do we got here?
Teres minor, teres major.
Yes. Which one's on top?
Minor.
Yes. And by the way, guys, I know they're named that way because they go on top of each other, but they do the complete opposite things. One rotates internally and one rotates externally. One rotates medially and one rotates laterally. We'll get to that later. What's this?
Infraspinatus.
Yes, it's part of what muscle group?
The rotator cuff.
Thank you, ma'am. What are these two muscles?
Infraspinatus and teres minor.
Yeah, beautifully said. What's this?
Subscapularis.
Yeah. What's this?
Supraspinatus.
Yes. And what's this? Oh,
Not supraspinatus.
It's been a long day.
Teres minor.
Teres minor, yeah. What muscle group is this?
Erector spinae.
Yeah. What's this?
Rhomboids minor and major.
Yes. Which one's on top, by the way?
Minor.
Yeah, minor usually rides on the shoulders of major. Yep, minor's on top. Doesn't matter to me, by the way. They're the same darn muscle as far as I'm concerned, but whatever. From a rubbing point of view, they're the same muscle. Hey, what are the actions of this muscle?
Retract the shoulders.
Mm-hmm.
Elevate.
Yeah, they do. That you nailed it. Retract and elevate. The scapulothoracic joint or the shoulders. The term retract is not really familiar to me. Can you give me another term so I can help possibly understand what you said?
Adduct.
Oh, they get closer to my spine. Thank you. That was really helpful. Thank you, ma'am. What's this?
Elevator scapula.
Yeah, thank you. And what's this?
Serratus anterior.
Yeah. Couple of questions about this just to wrap it up, and then we'll kind of release all a little bit of homework for you guys. Not a lot, I promise. What are the actions of this muscle? Sorry. Rumble is not one of them.
Does it abduct the scapula?
It does abduct the scapula. It pulls it back forward and away from the spine or protracts it. It also runs, the fibers run a little bit downhill because your ribs run a little bit downhill.
Does it do anything with rotation?
Well, actually, you could argue some of that too, believe it or not. But it depresses too. It pulls forward and down.
Okay.
And I'm trying to make a point here because the rhomboids pull back and up.
Okay.
Yeah. And I don't know if I'm going to ask the question right, so don't feel bad if you don't get it. But the rhomboids are hooked to your spine and insert into what? What bone? They go from your spine to what? Your rhomboids.
Don't they go to the scapula?
Yes. What part of the scapula?
The medial border.
Yes, you're doing really good. By the way, everybody, I'm not just saying this. We don't cover this in the first time we do this. We are way, way past where we normally go. They attach the medial border of the scapula. For $1 million, the serratus anterior anchors itself on your ribs, and it attaches into what bone? I mean, obviously it's on the ribs, but it goes to another bone.
Well, it goes to the scapula.
Yes, where?
The inside, the subscapular fossa or something. No.
Subscapular is in the subscapular fossa.
Border as well.
Yes.
Okay.
They attach to the medial border in front. And literally, I'm not exaggerating, guys, the serratus and the rhomboids they touch each other.
Okay.
And they are fighting over domination over your scapula. They're also helping you move your scapula. They're very helpful, right? Good job. Those are extremely hard questions, and I think you did very well, so I hope you do too. Yes. All right, I know I didn't get to everybody, and I don't like that, but I feel like we made a lot of progress, so I'm very happy about that. Give me 1 second here. Oh, yeah. All right. I of course, and I'm sorry to do this to you, but I, of course, have a TED Talk for you guys. And that's it. What did I learn today in a TED Talk? And the TED Talk, hold on, is coming out right this second. The TED Talk is called Your Body Language Shapes Who You Are. And it's available right now. We're done with this silliness.